Okay, we're going to discuss the case of Nadine. She is a 21 years old woman. Um, we don't know where she lives, but um, I heard that she was speaking in German. So maybe she comes from Germany or maybe Switzerland. Specifically, we don't know the city or the country, but for sure she is living in Europe because the scenes that we can see in the video are from places in Europe. Very important. She had uh, several losses because different family members die died, and that was a very shocking or a traumatic situation for this lady. And we can say that these stressants uh, activated in her the anxiety or anxious emotions, and that's why she is having this anxiety general disorder. We can say that Nadine has a post-traumatic stress disorder also, because the trauma or the trigger for this situation was several losses of family members close to her. Usually, when someone dies, someone that is close to a person dies, usually it takes 1 year to recover from that loss. In the case of her, there were several losses. We don't know how much time passed through each loss, but we assume that this is more than 1 year, okay? And this is important because the duel that she is experiencing is going to be longer, because she is associating the anxiety with the losses of her family members. And to continue with the case of Nadine, the question number 2 says, where is an anxiety disorder from the medical point of view? From the medical point of view, the anxiety disorder is an unbalance of the receptors of GABA. GABA is a substance that is in the neurotransmitters, in the neurons. And when the receptors are not working properly, a lot of GABA is remaining in the synapse of these neurons. And we can say that this is um, the problem that is causing the anxiety. And we can also say that from the point of view of the medicine, that anxiety disorders are a spectrum of disorders associated with, for example, we can say that there is a persistent fear, okay? Or we can say that there is a worry about something or someone, and this fear or this worry changes the behavior of the person. The person is not going to be in a normal behavior. This person is going to avoid people, or is going to avoid objects that are related to the trigger that activated this anxiety. So from the medical point, we can also say that there is also a problem in the serotonin receptors, in the also the noradrenaline receptors, and of course also a problem in the GABA receptors in the synapse of the neurons. To continue with the next question, the question says, what are the symptoms of this disease? Well, the symptoms, is important to mention that these in adults, at least 3 or more of the following symptoms are going to occur to diagnose anxiety. For example, the person is going to have irritability, the person is going to have a somnolence or fatigue, the person is going to have muscle tension, there is going to be also difficulties for concentration, insomnia is going to be present, also nervousness or restlessness, there are going to be also fear, and we can say that in children, only one symptom that I mentioned is going to be present or more to diagnose the anxiety disorder. This is very important to mention. We have also the next question. The next question is, what are the possible treatments that a doctor can provide and why? Okay, doctors have the ability to give a prescription. For example, we're going to give medicine like benzodiazepines, because the benzodiazepines, they are going to release the GABA that is in the synapse. We mentioned that the disorder of the anxiety, there is a problem with the receptors of GABA. With the benzodiazepines, GABA is not going to be a problem anymore because the medicine works in the synapse of the neurons. We can also give another type of medicine, for example, the serotonin inhibitors, tricyclic therapy. We can also give tricyclic medicine, also imao therapies we can also give, because these are going to work in the serotonin, in the GABA, in the norepinephrine receptors. We can also give antidepressants, because antidepressants also work in the same level of the norepinephrine and in the serotonin receptors. In the point of view of the pharmacology, this is going to be only a cure for the symptoms. We're going to treat or to manage the symptoms, but this is not going to be a complete cure, okay? How can we cure a problem or a patient that has anxiety disorder? Well, this is complicated because the person is going to need a behavior or a conductual therapy with a specialist. For example, the psychologist, they use these behavioral therapies that are very important, because these therapies are going to help the person to identify the root of the problem, okay? this is not going to manage the symptoms. This is going to resolve the root of the problem. So that's why it is important to use the psychotherapy. Psychotherapy is going to treat the problem from the roots. And that's where the doctors are not going to be too much active, because that's the field of the psychologists, okay? But we as doctors, we can treat the symptoms or manage the symptoms. The next question is about what are the possible treatments and why. Well, I already explained, doctors have a limited we can say coverage. We can make a prescription of medicine, but we are not going to give this psychotherapy. The psychotherapy is going to give by the specialist. Sometimes it could be the psychologist. Some psychiatrists have the skills and the preparation, the education to also give psychotherapy, but not all the psychiatrists. In Guatemala, it is possible, but in the United States, the psychiatrists only give also a prescription and leave the psychotherapy to the psychologist. The conclusion that I'm going to give to this topic is that we have to research more the patient. The problem of anxiety disorder is going to be a diagnosis of exclusion. What does that mean? That means that we have to exclude another metabolic disorders that can activate or trigger the anxiety disorder. For example, a problem that is very common in the emergency unit is that problem with the glycemia. For example, a person with hyperglycemia or an uncontrolled diabetes mellitus is going to give also or trigger psychiatric problems such as anxiety, because a person that has hyperglycemia has metabolic disorders, and these metabolic disorders also are going to damage the brain and the neurons in the brain. And that's why we are going to exclude another metabolic disorders or endocrine problems, or for example, a heart attack, myocardial infarction, or for example, an stroke, okay, a brain disorder is going to important to exclude when we have a patient that has a lot of fear or that has some somnolence, that also is going to present muscle tension. We have to exclude also metabolic disorders. It's important to make an electrocardiogram to evaluate the heart, because maybe a heart problem is going to make the person anxious and or nervousness, to give nervousness to that person. That is my conclusion. Always to exclude other medical illness or medical diseases before we are going to diagnose the anxiety disorder. Thank you very much.